How can biomarker discoveries improve CFS diagnosis? How can biomarker discoveries improve the diagnosis of chronic fatigue syndrome and myalgic encephalomyelitis? This question is crucial for many individuals who experience the debilitating effects of this condition. Currently, diagnosing CFS relies heavily on clinical symptoms and ruling out other illnesses. Unfortunately, there are no widely accepted laboratory tests or biomarkers available, making the process subjective and often frustrating for patients. However, recent research is changing this landscape. Scientists are identifying promising biomarker candidates related to immune function, metabolism, and even the gut microbiome. For instance, advanced artificial intelligence tools have been used to analyze data from gut bacteria, blood metabolites, and immune cell patterns. Remarkably, these studies have achieved about 90% accuracy in distinguishing CFS patients from healthy individuals. This is a significant breakthrough, especially considering that some medical professionals have historically doubted CFS as a legitimate disease due to the absence of clear laboratory markers. Specific findings from ongoing studies reveal alterations in the gut microbiome, such as reduced beneficial fatty acids and increased markers of microbial imbalance. These changes correlate with inflammation in the immune system. Additionally, blood-based biomarkers have been identified that indicate inflammation, insulin resistance, and liver function abnormalities. Notably, some of these markers differ between men and women with CFS, highlighting the complexity of the condition. The potential benefits of these biomarker discoveries for diagnosing CFS are substantial. First, biomarkers provide objective testing, offering measurable biological data that can confirm the presence of the disease. This reduces reliance on subjective symptom reporting, which can vary greatly between individuals. Second, identifying biomarkers can lead to earlier and more accurate diagnoses, helping to avoid misdiagnosis or the dismissal of symptoms. Moreover, biomarkers can help differentiate CFS from other conditions with similar symptoms, such as depression or other fatigue-related disorders. This distinction is vital for ensuring that patients receive appropriate care. Additionally, understanding individual biomarker profiles may pave the way for personalized medicine, allowing healthcare providers to tailor treatment approaches to target specific biological disruptions. Biomarkers also play a crucial role in research and drug development. They can serve as endpoints in clinical trials, facilitating the creation of effective therapies for CFS. However, while these findings are promising, it is essential to note that further research is necessary. We need to validate these biomarkers for routine clinical use, ensure their specificity to CFS, and understand how they may change over time or with treatment. In conclusion, biomarker discoveries hold the potential to transform the diagnosis of CFS by providing objective, biological evidence of the disease. This progress not only enables earlier and more accurate identification, but also fosters personalized care. Additionally, it helps legitimize CFS as a biological illness, countering past skepticism and improving patient support and advocacy. For anyone experiencing symptoms of CFS, it is always advisable to consult healthcare professionals for personalized medical advice.